Welcome back. During the holiday season, probably goes without saying, the main attractions for this time of year are visits with family and friends. Despite all that festive fun, these celebrations can take a toll on your health. So this morning, we're breaking down how you can stay healthy during the holidays. Joining us now to talk more about making healthier choices during the holidays, NBC News medical contributor Dr. Vin Gupta. Doctor, good to have you with us. So as we heard earlier, travel, obviously a huge part of the holiday season. AAA predicts more than 119 million Americans are going to travel between Christmas and New Year's. And as we know, traveling increases your exposure to others. You're packed into the planes. It can also increase your risk of getting sick. So what can people do to just stay healthy overall while heading to their holiday destinations?
Well, so that's exactly right. And, the basics work. You and I have been talking about the basics for over 5 years now, ever since COVID. But what I do when I'm at 30,000 feet in that aluminum tube is I make sure that I have something to clean the area around me. So a Clorox wipe or something like that. Hand sanitizers are critical. I think we've lapsed on that, frankly. And then always have a mask, especially if you're medically higher risk. You don't know and you can't control the behavior of those around you. And frankly, we've all been there. Somebody's coughing right next to you. They're not covering their mouth. So at least be armed with it. If you're medically higher risk, I would definitely recommend always wearing that in a closed space, but always good to have that.
Yeah, I went to a couple shows over the weekend, brought out the mask for the first time in a while just to try and keep healthy as possible during the holidays. So speaking of getting sick, the CDC on Friday actually issued a health warning saying flu cases were on the rise across the country. That is something we expect this time of year, but do we think these cases are going to continue to climb as people do get together for the holidays?
Yeah, they should, and so usually we see flu, COVID, even RSV probably peak end of January into February. So we should expect more of this. And it's a great reminder, especially if you're medically higher risk, over 60, underlying medical condition, Joe, if you wake up with flu-like symptoms, fevers, upper respiratory infections, get tested because early testing enables early treatment. Tamiflu for flu, Paxlovid for COVID-19, and we know that can help keep you out of the hospital. There are now, for the first season, cold and flu season, over-the-counter tests, you can get them online for about $10. That test not just for COVID, but also for flu at the same time. So we're in this new era. You can look them up online and makes it a lot easier to get that rapid treatment.
We just saw a graphic that talked about preventing the flu. What are your best tips to try and avoid getting sick during the season?
Well, it's not too late to get the vaccine. I get this question a lot from people. Is it too late, Doc? I was busy earlier in the fall. It's not too late. It takes about 2 weeks to work, but get COVID flu at the same time. RSV is a one shot for your lifetime if you're over 60 or medically higher risk. So that's the key here. And then all the things we talked about, especially if you're traveling, those are really the critical things for prevention.
And that's a question I know a lot of people ask. If you're going to go get the shot, you need to get your flu shot. Maybe you didn't get that COVID shot yet. You do recommend getting them at the same time, right?
I got them at the same time. It's safe. You can get them in the same arm to spare your other arm for normal activities of daily living. No reason not to. It doesn't impact the effectiveness of either. That's a concern sometimes people have. It doesn't in any way hamper your immune system or recovery. Completely safe, and frankly, it's time efficient.
Yeah, and we know flu shots among kids are at a low level right now, so hopefully people will heed that warning and get those vaccinations. Dr. Vin Gupta, as always, thank you so much.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.